Hello everybody, welcome to my channel. This is a pathology video on respiratory pathology. The topic is bronchiectasis. This is the third in the series of videos on bronchiectasis and it covers one of its causes, that is cystic fibrosis. The presenter is Dr. CSBR Prasad, Professor of Pathology, Sri Devaraja's Medical College.
And coming to the second disease process, that is the cystic fibrosis, which is otherwise known as mucoviscosis. So, as the name itself indicates, the secretions in these persons are thick and tenacious. So, cystic fibrosis is a systemic disease with a prevalence of 1 in 2,500 live births, but it is not common in Asians and Africans, and pulmonary involvement dominates the clinical feature. And inheritance is autosomal recessive, and usually these fellows will die of respiratory infections or respiratory failure. And in cystic fibrosis, because of production of thick tenacious fluids in the glands and ducts, the ducts will and glandular lumens will be completely obliterated. So if it is the pancreas that is getting obliterated, the pancreatic juice cannot enter into the intestine, the patient may suffer from malabsorption syndrome. Or recurrent attacks of infection of the pancreas due to this type of mechanical obstruction, they ultimately result in fibrosis. And biliary passages, if they are affected, the patient may have cirrhosis or jaundice. And if the vas deferences, seminal vesicles are blocked by the thick tenacious secretions, the patient may have sterility. And in the lungs, tracheobronchial tree blockade results ultimately in production of bronchiectasis. In the gut, it may cause meconium ileus. So meconium ileus in the newborn is a very well characterized finding which is associated with cystic fibrosis. So if the baby develops meconium ileus, possibility of cystic fibrosis should be on the top of our differential. In addition to that, as a part of testing, sweat from the sweat glands are collected and they are analyzed for the concentration of sodium and chloride. So in this cystic fibrosis, sodium and chloride concentrations are high, and that forms a basis for diagnosing cystic fibrosis in the laboratory. And if you recollect the first image, which was showing a device connected to the arm of a baby. So that device collects the sweat and which will be later analyzed for sodium and chloride concentrations. And pathogenesis, I told you already. So secretions are viscid and thick. They cause obstruction to the passages, and because of this, they form. There is infection, and repeated infections cause what is known as permanent damage to the ducts and also permanent damage to the tracheobronchial tree. And because of this, there is dilatation, which will called as bronchiectasis. And so one of the components of this cystic fibrosis is bronchiectasis. So coming to the molecular pathology of cystic fibrosis, the gene identified is CFTR, which is located on chromosome 7. It is an anion channel, and there are some 550 mutations have been characterized, and which may be associated with the different degrees of clinical manifestations in cystic fibrosis. And this slide represents the degree of severity that can be associated with mutations in cystic CFTR gene. So it may be just a mild abnormality like poor sperm quality, or it may be absence of vas deferens, or it may be full-blown case of cystic fibrosis. Pathogenesis, I told you already, thick mucus causing obstruction to the bronchus, forms a rich culture medium, growth of infectious agents causing infection, inflammation, fibrosis and dilatation.
Thanks for watching. Please subscribe by clicking the button subscribe.